When we talk about examination, so yeah, some of you may have passed that era of examination. I mean, so when we are practicing nowadays, when we examine the patient, when we put the stetho on, when we look for clubbing, when we check for glands, hardly. So, but sometimes, a patient feels good if you just touch them, if you just feel them. And also it's good for you that if you put the stetho on, or if you just pick up a clubbing or pick up a cervical gland, or pick up some murmur there, or say there is some tonsillar enlargement or cobblestone appearance on the back of the throat, or some palpable thyroid, or some rash which the patients are wearing a full sleeve and maybe they're seeing. Sometimes eczema and asthma, they share an inverse relationship. I mean, if the asthma flare up, the eczema gets better. If eczema flare up, asthma gets better. I really don't know the reason. I have to read through it. I haven't read it always. I think that I have some interest in it. But in general, when we see the patients, we have seen some inverse proportion to this kind of problem. So when you also, I don't need to go through what are the things you will examine. But nowadays, when examination happens, if there is any candidate who is taking any postgraduate examination or this final examination, MBBS examination, yes, they have to check clubbing like this. But for us, if we hold the hand and just see like this, we will pick up clubbing. So, and that's good enough for us. So something we can do after passing, which we cannot do in the exam hall.